If you have Crohn's disease or ulcerative colitis and are thinking of starting a family, or are currently pregnant and want to know some tips on how to increase your chances of having a healthy baby when you have IBD, then stay tuned as I'll give you my top tips on maintaining a healthy pregnancy. Welcome back to my channel, the only place for Crohn's and colitis tips, tricks and information. So make sure you subscribe to my channel and hit the bell to be notified every time I post a video. And if you want to join an exclusive community of people who receive tips and tricks on living with Crohn's and colitis, make sure you sign up to my newsletter by visiting the link in the description box below. Now, it may seem a bit weird, a guy giving pregnancy advice, but the topic of pregnancy and fertility really interests me and excites me. And some of you may not know that I've done a master's in reproductive medicine and worked in the pregnancy and fertility field for a few years before becoming a radiographer. Now, before we get into things, always remember it is important to discuss any concerns you have with your doctor and to have regular antenatal checkups to ensure you and your baby are doing well if you are pregnant. So let's get started. Number one, probably one of the most important things, if you are in remission or not experiencing much symptoms from your IBD, then it is ideal to try and stay like that throughout your pregnancy. I realize that this is slightly out of your control, as Crohn's and colitis is very unpredictable and flares can happen at any time, but there are a few things you can do, like keep taking your medication, avoiding trigger foods and controlling your exposure to stress that can help. Number two is diet. If you have IBD, then you may have some nutritional deficiencies such as iron deficiency anemia, and so it is important to have an overall checkup with your doctor and dietitian to make sure you are healthy, as during pregnancy your nutrition stores will be used up by your baby to help it grow, which is why you may have heard the phrase of eating for two. It is important to have a balanced diet and to eat the right type of nutrient-rich food that will help your body function properly and support the development of your baby. Number three is supplements. This is linked to diet because, as mentioned, you may already have some deficiencies due to Crohn's or colitis, but you may also need to take extra supplementation during your pregnancy. Folic acid supplements can help support pregnancy and the development of your child because it can help prevent neural tube defects. It's recommended that women should be taking about 400 micrograms per day, and some women with diabetes, epilepsy, and who may have had neural tube defects themselves may be more at risk of having a child with neural defects, and so may need a higher dose of folic acid. Folic acid supplementation is advised while you're trying to conceive and up to the 12th week of your pregnancy. Vitamin D supplementation may also be required, as it's needed to ensure calcium is absorbed to help formation of bones and teeth. Lack of vitamin D can cause rickets and impact maternal bone health. Iron supplementation may also be needed, as a lack of iron can cause iron deficiency anemia. Now, when it comes to vitamin A, you need to be careful because vitamin A is needed to help development of heart, lungs, kidneys, eyes and bones of the baby, as well as the circulatory, respiratory and nervous system. But too much vitamin A can cause birth defects, so pregnant women should avoid eating liver products such as pate and avoiding taking supplements that contain vitamin A. Before you start changing your diet or taking any form of supplementation, you must see your doctor, nutritionist and consult your IBD team to make sure that you are doing it safely and correctly. Next is to stop smoking if you haven't already, because smoking during pregnancy can harm your baby and its development, causing birth defects and can increase the risk of you having a miscarriage. Linking back to the first point, smoking increases the risk of having a flare-up, which is never ideal, as your symptoms could then get worse. Number five is similar to smoking, is alcohol. Stop drinking if you haven't already. If you're pregnant or thinking of getting pregnant, the safest thing to do is to stop drinking, because alcohol can pass to the baby through the placenta. Drinking during pregnancy can increase the risk of your baby being born with something called fetal alcohol spectrum disorder. Your baby is unable to process alcohol like you, and so damage can occur to vital cells in their brain, spinal cord and other parts of their body, which can result in physical abnormalities, learning and behavioral problems. Number six is exercise. This will be beneficial for you and your baby. Remember that the types of exercise you do needs to be sensible, so listen to what your body is saying to avoid getting injured. Exercise doesn't have to be done in the gym, but it can be going for a walk, a swim, and some find it good to join an antenatal yoga and exercise class to not only meet new mums and have a social aspect during their pregnancy, but to remain fit and healthy as well. Now, those are my top tips on what you need to do to increase the chances of having a healthy pregnancy and child with your IBD. But remember, it's important to discuss all of this with your doctor and IBD team. So now make sure you check out these videos on more useful tips, tricks, and information for Crohn's and colitis. Hit that subscribe button and the bell to be notified every time I post a video, as well as leaving a like and a comment if you enjoyed this and found it useful. And I can't wait to see you all in the next episode.